Nigeria has the highest neglected tropical diseases burden in Africa, with more than 200 million persons at risk of at least one Ntds. Today on Sound Health, we are taking a look at what are neglected tropical diseases and how to prevent the diseases by 2030. Good evening, I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
We have more than 1 billion people who are at risk of these diseases. There are things like worms that are in your intestine, taking away your nutrition, and that stops kids from being able to learn in school or parents from being able to work. Guinea worm you get when you drink water that's got these small worms in it, and then it grows inside your body. And as the worm gets larger and larger, it causes intense suffering, itching. So people typically go get in the water, which actually allows the worm to escape. It actually leaves your body and goes back in to create its life cycle. Elephantiasis, there's a set of worms that actually go and live inside your lymph nodes. Your lymph node just grows very dramatically. And so whenever you see very extreme things where somebody's leg is 10 times the size it should be, or other parts of the body, that's typically elephantiasis. River blindness causes you to go blind. If you live in a rural village, that's even worse. Now, there's no braille books, farming type work that you would normally do is very tough. Amazingly, there are drugs to help treat most of these diseases. And so we worked with the drug companies to get huge donations and donors to fund getting out and having everybody who needs them take these pills. And if we do this well, a lot of these diseases can actually be completely eliminated.
Joining us via Zoom this evening is Dr. Jamiu Ganiyu, and he is going to share his expertise on neglected tropical diseases. Dr. Ganiyu, good evening, and thanks for joining us.
Good evening, thank you.
All right, Dr. Ganiyu, in basic terms, what is, or tell us what are neglected tropical diseases?
Okay, neglected tropical diseases are 20 groups of diseases that are transmitted by viruses, bacteria, protozoas, and Ntds. And usually they affect over 1 billion marginalized population. They are common in sub-Saharan Africa, part of Asia, South America. And the common thing with them is that they're associated with conditions that has to do with poor sanitation, inadequate water supply, and poor hygiene.
All right, Dr. Ganiyu, thanks for that explanation. Is this actually a cause for concern? Should we be worried about the numbers of people at risk of this disease?
Yes, we need to be worried, especially in Nigeria, considering the fact that Nigeria is one of the 16 countries that consume about 80% of Ntd burden globally. And looking at Nigeria in Africa, you find that 25% of the burden in Africa is in Nigeria. So we need to be really, really worried about it. And one thing about them, they have some, as I've said, you tend to see more them among the impoverished population. And one thing is that they're associated with issues that has to do with malnutrition, anemia, issue that has to do with growth in children. And another thing that they are common among children, you can see them from preschool, school age group, adolescent, and adults. And I think it's very important looking at it and in the public health angle. It is important. They've been for some time that we don't really pay much attention to them, and I think they are still with us, and certainly we need to do something so that we can meet the WHO target of eliminating them by 2030.
All right.
Just to say again, example of them are we have lymphatic filariasis, we have schistosomiasis, we have onchocerciasis, we have scabies, we have leprosy.
Okay, all right, Dr. Ganiyu. Dr. Ganiyu, I would like to come in there. Now, I would like to cut you short there now. I was going to ask you the most common in Nigeria and the basic terms. You know, no member of the public would know what all those medical jargons you're mentioning now. Can you please tell us in basic terms? I know you said we have leprosy. What are the other common names that we can easily relate to?
Like lymphatic filariasis, we call it elephantiasis.
Okay.
You see people with big limbs. It can be the lower limb, it can be the upper limb. Very big. You see them with the skins on those swelling will be so thickened, and so those are the way you see them. It can even cause scrotal swelling. Some can even present in the hospital with scrotal swelling. So these are ways, especially the lymphatic filariasis can present. For like the onchocerciasis, they call it river blindness. That's the common one. That one can present with the issue of blindness. And also they also causes swelling of the body, itching and so on. And also they can even affect the genital area with causing genital swelling, which they call hanging groin and so on. So that those one can present like that. And also like in our riverine, you see the onchocerciasis around all these fast flowing rivers, streams, and so among farmers. Also another one is the blood flu. That we call schistosomiasis. That one, you also people present with bloody urine. You know, they'll be urinating with blood and so on. Some can present with abdominal pain and bloody stools and so. So these are some of the ways those one can present. Like for the trachoma, they can present with future suggestions of blindness. The eyelid we kind of lashing, trying to affect the eyes, causing blindness and so on. So they can present in such a way. And again, the soil infected Ntds is common among that's why you see that's why with the warmer children they can present with children complaining of example of them. We can have the ascaris. Those you can have the ascaris. We also have what we call the hookworm. Guinea worm is another one. You see a lot of lesion on the legs. You see them bring, some of those worm. You see them try to come out from the legs, and so that's guinea worm is different. It also affects people. But the key thing about them is that they cause a lot of in terms of one, they can lead to malnutrition. Apart from that, they can lead to deformities. Those ones I mentioned now, and that may cause a lot of mental and social disturbances in individuals that are affected, and in so doing, they can also lead to stigma and discrimination. Like the hookworm might cause, they can cause anemia. Are you getting in children? And if it affects adolescent girls and women, it can even lead to increase in maternal and child mortality. So these are some of the ways some of those Ntds can present, and that is why the country need to pay serious attention to that. They are with us, and one good thing about them is that the treatment for them is not as expensive as other infectious diseases and other diseases. So the treatment is available, and so like for instance, like if you are talking of the soil, majority of the soil transmitted Ntds, they can be treated using anti-emetic drug like albendazole, mebendazole, and so on. And then for the onchocerciasis and we can use infamectin, we call metizan, which was used during COVID-19. So the treatment for them is not too expensive. It's just that the only thing about them is that diagnosis may, because they are not too common like every other infectious diseases. So diagnosis may take a lot of time, but diagnosis is not as also expensive. Ordinary stool microscopy, urine microscopy, and so on. Because, for instance, like the soil transmitted Ntds, majority of them the eggs we secrete them in feces, especially majority are due to actually poor sanitation hygiene. Maybe somebody through open defecation. And if majority of them are contained in fecal matter, so when somebody in places where they practice open dumping, the egg are released into the environment. During that process they get contaminated with the soil, and during when we plant and our vegetable and fruits, if they are not properly washed and so on, and the hand is contaminated, they get swallowed, and through that process they develop in the human body, shed more eggs, and the cycle continues. So I think with proper sanitation, good proper hygiene, as well as availability of adequate and quality water supply, I think we can reduce some of those Ntds to the minimal level. Thank you.
Rabies, scabies are also, as well as dengue fever, are also part of the NTDs, the neglected tropical diseases. Are these diseases communicable? Because I know we are always advised to avoid infection from any animal that has this disease. Is this also communicable?
Many of these diseases, they have intermediary hosts. Not that there is no human transmission, but what they have is that they have vectors. Like for instance, now you made mention of dengue. That transmit through a mosquito. You understand what I'm saying? So, through mosquito bites, like scabies. They are ectoparasites. They are on the skin, so they have some of these organisms that also incorporate them. But scabies can be human transmission, especially when you are sharing bedding, sharing clothes. As I've mentioned earlier, some of these are true poor hygiene situation where there is no adequate water supply. People don't take their bed, they mix together, sharing utensils and so on, beddings and so on, so they can get transmitted. For instance, I mentioned the fatty the one I call elephantiasis. They are transmitted, especially in the environment, through mosquito called Culex mosquito. That is, you can get urban transmission and semi-urban transmission. Urban and semi-urban transmission is Culex that is responsible for that through mosquito. Culex is an example of a mosquito through mosquito bites, so they can transmit it from one person to the other. And if it is in the rural area, we have anopheles. In some areas, AD. So some of them are usually vector-borne diseases that are transmitted, but human transmission is not. So that's why we can't. They are communicable, but not that they can be transmitted from one woman to the other. But they have the example of a vector that is responsible. Like the one I call river blindness, we have black flies. I don't know that the area of that similar damnosum. So they can, when they bite people. Are you getting me? What they do is that when they bite an infected person, several times they have the ability, when they meet a susceptible host, they bite that person, they help in transmitting that through the skin and before eventually get into the subcutaneous tissues and so on. So these are some of the ways they can be transmitted. Are you getting me? Then also, like the schistosomiasis, also need the vector, the water snails. I don't know whether you have been hearing of the water snails. So also, what they are like intermediate hosts. Usually when they get in there, develop into larval stage and so on. And if people go have access to maybe a river area, they can easily, get through the skin. Are you getting and get, an infected person transmitted. And I said we have different types of schistosomiasis, like the hematobial now. You find it around the kidney area, the bladder, and they're associated with bladder cancer of the bladder and so on. They can even cause kidney damage. Then we have other one, the mansonite. That one affect the intestine. So those ones, they can also cause anemia, malnutrition, and so on. And if not properly taken care of, they can affect the liver, damage the liver, lead to what you call portal hypertension and so on. So I don't want to speak some of these medical jargons. So the common thing with them is that they have their diagnosis is not expensive, and their treatment is also not expensive. But everyone had a different pathway in terms of pathogenesis, that is causing if diseases in individual. But the common thing is that they are curable if appropriate action. And as I've said, that using public health approach is one of the simplest way we can do that. And I've mentioned good sanitation. I've talked about issue of adequate water supply and ensuring that people practice good hygiene. People need to change their behavior so as to maintain good hygiene practices. Through that process, we can nip that in the bud. And in a situation whereby it has become an issue, maybe it involves a large population, there are different approaches to managing them. That is what we call mass drug administration. In a place where it's endemic, what they do that they provide it could be antibiotics, it could be those drugs I mentioned. They give it to a very large number of people. Usually they do it annually to prevent, we call it preventive chemotherapy. That is, you are trying to prevent a kind of transmission from one person to the other by giving people prophylaxis. A large mass of people will be given prophylaxis. So those are different ways. And where there are complications like that elephantiasis, they may require surgery. Apart from treatment, may not giving ivermectin or any of those albendazole may not be enough. That they need for corrective surgeries to correct those places. And I mentioned trachoma. Also, that they need to correct the eyes where applicable. So it depends on the type of the neglected tropical disease I'm talking about, and the level of damage to the body. So that would depend on how managed it is being instituted. Thank you.
World Health Organization cited ignorance as one of the reasons we keep having a worsening burden of the Ntds in Africa. From your explanation now, it is obvious that we truly don't know. Some people don't know about these diseases. But how do we change the narrative?
Yeah, that will change this through public awareness, because ignorance, when people I know about a particular disease, they may not know the actual preventive measure to apply. So, based on what you just said, I think we need to create public awareness, especially about this the different types I mentioned, and also apart from public awareness, especially also looking at especially those areas where we find that, as I mentioned on like psoriasis, you see it around streams area, communities where there are streams, and so there should be public awareness about them. And also in terms of awareness, that I think in such area we have to talk about health promotion strategies need to be applied. For instance, giving them health education, ensuring that people cover themselves to avoid mosquito bite, use of mosquito nets. So those are some of the things, and those that are affected, we make sure that we treat them as much as possible. And where it has become an endemic thing, I mentioned the issue of mass drug administration, so we can do it annually and so on, so that we can achieve some level of control in such community. But certainly, public awareness is very important, health education is very important, and I mentioned the issue of preventive chemotherapy, where it is endemic, is also very important. But we cannot run from, as I've said earlier, government intervention in terms of ensuring that when applicable, they ensure that there is adequate provision of good water, quality water, ensure there is availability of adequate water, and also quality water, as well as also part of the education should be about talking about hygiene. Hygiene, very important. You need to let them know about that, and also they need to take care of the environment, where in terms of cleanliness, avoiding bushy environment and so on. So these are some of the interventions, and where some have been diagnosed, there is need also to treat them. I think those are the areas we can. And for those that have developed complications, I've just mentioned it, which is the secondary aspect of, secondary prevention. They need to allow to undergo surgeries for corrective procedures. And for in terms of the third prevention approach, that may need to talk about rehabilitation, because some of them, those that have been stigmatized and develop psychological problems, they need to undergo some level of rehabilitation and so on. And those that have had issue with labor laws and other job laws and so on, they need to be taken to a kind of rehabilitation so that they can reunite back with the family and continue their normal life.
Prevention, they say, is better than cure. We need to step up our water, sanitation, and hygiene wherever we are to beat neglected tropical diseases. Dr. Jamiu Ganiyu, consultant public health physician, thank you so much for your time and expertise on sound health.
Thank you very much. Thank you.
All right, I have been speaking with Dr. Jamiu Ganiyu, consultant public health physician, on how to eliminate neglected tropical diseases by 2030. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Before we wrap up the program, let's take a look at World Patient Safety Day. Please stay tuned. Well, this is where we say thank you on today's episode of Sound Health. Neglected tropical diseases can be eliminated, whether they are scabies, leprosy, rabies, elephantiasis, dengue fever, and every other common Ntds in Africa. We can do that by 2030 together. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.